M2015 Patient Caregiver Drug Education Intervention. Patient Caregiver Drug Education Intervention at the time of and any time since the previous OASIS assessment was the patient caregiver instructed by the agency staff or other healthcare providers to monitor the effectiveness of drug therapy, adverse drug reactions, and significant side effects, and how and when to report these problems. Medicare's intent for this indicator is to ensure that the clinicians assigned to treat this patient instructed the patient on all aspects of the patient's medication regimen. Safe medication management includes the patient's knowledge of side effects and adverse reactions, as well as when to contact the physician. This item is classified as a process measure, and the item is not only scored for your agency as a component of value-based purchasing, but it is also data collected for the agency's star rating. So it is very important that the clinician knows the importance of answering this and all OASIS questions accurately and timely. The time frame in which this is collected is at the transfer to an inpatient facility or discharge from the agency OASIS. Clinicians should always instruct the patient caregiver on medications, including effective drug therapy, adverse drug reactions, and significant side effects. These indicators, as previously stated, are only collected at transfer and discharge from agency. So, a clinical record review or interview with the clinician assigned to the patient could be the best resource to accurately collect this data. The medication review should include all medications, including over-the-counter medications, vitamins, or dietary supplements, including eye drops. The review should also include duplicate drug therapy, as well as drug interactions and side effects. The clinician should always assess the patient's orders and compare those orders to the actual medication the patient reports that they are taking to what is actually in the patient's home. Always notify the physician if the patient experiences any adverse effects and ensure that the patient is knowledgeable about their medications. Clinicians should practice medication teaching on every visit and double-check for new or changed orders after each physician's visit. Also, it is very important to ensure that the physician knows what medications that are in the home and reportedly taken by the patient. If for any reason the patient or caregiver were not given medication instructions, then the clinician should document in the patient record as to why the patient or caregiver were not instructed on the medication regimen. Make sure you consider the time frame at the time of or any time since the previous OASIS assessment.